Hey, today I'm speaking with Dr. Jamie Bovay. He is the author of this book here, Adding Insight to Injury. He decided to shave today, as you can see here on the book.
Just today. Yeah.
And he's the owner of Kineticchain Denver Physical Therapy, of course, in Denver, Colorado. And he is a specialist on working with the everyday athlete. So I'm excited to ask him questions today about his book, as well as just gain some expert knowledge from Dr. Jamie. And so welcome to the show, Dr. Jamie. Thanks for coming.
Yeah, thanks for having me. I'm super looking forward to talking about it.
So excited to have you on here. Your book, by the way, is such a fun read. It's so easy to digest. You're so authentic and just out there. It feels like I can hear your voice in my head, and like you're just a pal, just sitting next to me chatting away about injury stuff. And so it's very readable, not at all like over your head technical. So for those of you out there are looking to just gain some practical insight, obviously, on how to deal with problems, aches and pains, you got to get this book. There's a link in the description below for it. And we're going to hear more from Jamie. So tell us a bit about yourself. How did you get into this specialty of working with the everyday athlete?
Kind of a long, circuitous path, but I wasn't originally, like many other people in PT. I kind of wanted to work with the professional athletes. They're the big, sexy thing that everybody is super attracted to. But after working with several for a while, I just found that I couldn't relate to them as much. We don't have the same lifestyle, the same needs, the same fears. And so after working with them for a little while, and then as I was working with the everyday population, I just found that I was able to get the best results for those everyday athletes who were driven, who were motivated to get back to the things they love to do, and had a passion and a fire behind them to be able to do those things, and not only do them, but do them well and do them with the people they love to do them with. So, I think there's just a certain connection there. And, when you can connect with your patient as well as get them good results, they love the whole thing. You can understand them on a whole new level, and you can answer questions that they don't necessarily know they have. And so since we've been kind of focusing more on that everyday athlete, or the Colorado active, as we like to call them, the person that skis in the winter, bikes in the summer, rock climbs on the times in between, since we've been focusing on those people, been getting great results and really have found a way to communicate with them and give them the results they're really looking for. And so thanks for saying that about the book, by the way, about kind of the tone and everything. We wanted it to be a conversation. We didn't want it to be overly over the head. We wanted it just to be like friendly advice, like, the advice you'd give a friend across the country by phone if you were a PT and had somebody asking you questions, but at the same time, giving them honest advice, giving them some things that may be a little hard to hear, but in a friendly way, correcting all their fears, and just really kind of communicating it on a level to give them all the information they need about getting better and how to do that. So this is really an injury guide, area injury recovery guide.
Yeah, it's so practical. It's very super easy to read. I mean, I was reading through there and I was like, wow, I'm already like 70 pages in, and it feels like I was just hanging out here for 10 minutes. So and it's
hopefully that wasn't because I wrote it on a third grade level or something. big words. No.
That was super good. Well, what led you to write the book? Why did you decide to put something together like this?
Well, I think in the clinic we hear the same questions over and over, and we know how it goes. As somebody who is struggling with an injury, the first thing you're going to do is you're going to search on Google, right? Dr. Google, he's number one thing you're probably going to do. The next thing you're going to do is you're going to look on WebMD. The next thing you're going to do is you're going to look on YouTube. You're going to look at exercises. Then you're going to ask your friend. All these things don't work. There's a reason they don't work. General advice doesn't work for a specific problem. So we knew what everybody was going through. Who are these athletic, motivated people? We know the mindsets. We knew the questions they had. We knew how to answer them. And we wanted to get the answers out there to the public so that we could stop some of the myths around healing and injuries and recovery, stop some of the fears around that, and really give people the information to make the best decision about their health. And so, once you can make that right decision, you can start leading yourself down the path to recovery. But without the right information, you can try as hard as you want and still fail. And so we just wanted to give the information to people so that they can make the right decisions.
Awesome. Well, I'm so glad you put it together. And there's just a preview here because I especially loved your section on the shoulder. I mean, you got some simple pictures on here. I love how you put a golf ball and a tee and use it as an analogy for the ball and socket joint of the shoulder.
Mm-hmm.
So easy to understand and grasp. So it's so cool.
Thanks.
If you can share some of the information in here, like maybe just a quick tip about how to help maybe with shoulder problems.
Sure.
What do you have to share with the viewers?
Yeah, so shoulder pain is one of the number one things that we see in the clinic. So some simple mobility drills just to get more shoulder elevation can really help for the shoulder as well as the thoracic spine and the neck. So what I'm going to show here, get my background here, is a simple way to do that so that we can improve the mobility, relieve some pain, and start to move in 3 different planes of motion. Because what we see is a lot of times, maybe you move well in 2 different planes of motion, but kind of the other one you don't move. And you need to move well in all 3 or it can lead to injury. So an exercise we can do is we can put our hand kind of low, like belt high right here. And then I'm going to sink my butt back. As I do that, my arm will come up like that. So as I do that, I'm moving my thoracic spine, upper back here, moving the shoulder. And then what we can do is add another plane of motion in. So it's going to be hard to see, but I'm going to twist my butt away like that. That's going to give me a larger stretch through here. So that's the second plane of motion. And the third plane of motion, we're going to add a rotation in. So I'm going to reach with this hand and rotate my spine. So back and then reach up, reach up. So if we do all those things, we're going to loosen the joints, the muscles, and the fascia around the shoulder, and we can really loosen everything in the shoulder, get better shoulder elevation, and sometimes get rid of pain just with that. Other times it's more likely just a piece of the puzzle, but can help to improve motion and get rid of pain.
Awesome. I love that how you did 3 different planes, because usually stretches are just one plane. It's just kind of push it this way and that's it. But when you start adding all the other different motions, it just adds whole new levels. You get to you can access the spine that way, the shoulder blade, of course, the ball and socket joint. And then I think of the muscles in 3D. So that's perfect.
Well, most stretches you find are just aimed at the muscle, right? They're not aimed at the muscle, the joint, and then the other joints around them that need to move as well. So I like this one because it integrates the shoulder with the shoulder blade, with the spine, with the ribs. And then once you start adding the rotation, you get the fascia and you get everything else. So yeah, you're absolutely right. It's just a better way of dynamic stretching with movement.
That's so good. With somebody who's coming into your office for a shoulder problem, it's kind of talking about what we're discussing here, how you just think of one way to stretch it. What's something that you see common shoulder injuries with? Like what's the treatment pathway that people usually follow that doesn't work out too well? And then they get to you and they're like, holy crap, this is a lot better. What do you
I mean, there's a couple different ways that people can get there with shoulder injuries, but I think there is kind of like you're saying, there is a commonality between them all. So typically people are going to go see their primary care physician, and primary care physicians are wonderful, but they're not specialists in musculoskeletal care. So, they typically will then refer you to an orthopedist. The orthopedist is then probably, if he thinks you have an injury, he's probably going to refer you for an MRI. After the MRI comes back, chances are it's not bad enough that you need a surgery. And then they're going to send you to PT. At that PT clinic, you're probably going to get a, how do I say this nicely, a non-personalized, non-friendly feeling clinic where they're more interested in, what is your insurance information than they are actually about you and your goals. Then, these clinics tend to have a reputation of, easy banded exercises. Instead of working with the doctor of physical therapy, you're working with a tech or aide, which is a fancy way of calling somebody without a medical degree something else to try to confuse you. They work with the techs and aides, and then, they don't see the progress that they want. And I think it's sad, because physical therapy can help almost everybody who has injuries. And that's not physical therapy. That is glorified personal training at best. And people don't get better that way. And because they don't, then the next thing, when they go back to the orthopedist, they get an injection. When that doesn't work, then they get a shoulder surgery. Most of these shoulder surgeries are completely preventable, completely preventable. Um, so that is the typical path. It's not the best path by any means. It's just the common path. And I think we have to start doing a better job in the medical profession of realizing what is common and what is normal. And just like every other profession in the world, there's really good providers and there's really bad providers. What is the right fit for that patient? We need to do a better job of finding the right patient PT fit.
Yeah, I get what you're talking about 100%. I've worked in clinics like that. And I think what I've picked up on over the years, and I talk about on this channel all the time, is we're all specialists in different things. Like, you got your everyday athlete specialty. Like that's a thing. Like that's a niche of people
Yeah.
that really need your specific help. But
Yeah.
your typical clinic that has a lot of aides, a lot of assistants, they tend to handle post-operative care very well. Like they're
Mhm.
good at handling the people that just had surgery, knee surgery, back surgery, that kind of thing, because it's kind of a routine treatment. It's like, yeah, get on the bike next, yeah, do this exercise. You don't need a whole lot of technicality for it. There's some for sure, but helping somebody out who's an everyday athlete who doesn't want surgery and wants to hit the slopes again on, go skiing or run or bike or climb, you need somebody who's got a little more specialization than your college kid that's trying to get into physical therapy school for sure.
Yeah, yeah, and I think I use the or I tell the story in the book of there's a really active young female, very very athletic, and she tore ACL, and she ended up she went to her parents' house to do her rehab in Florida in Siesta Key, and the second youngest person in the clinic was 77 years old. This is a 26-year-old girl who was hoping to hit an Olympic weightlifting record the next year. So she really lagged behind. And I kept getting texts and I was like, this is not right. Like, and it was kind of weird to do, but I was like, you got to move back to Denver so I can help you. She moved back. She ended up doing great. But like, when she was 8 weeks out, she still couldn't straighten her knee. And, as a PT, that's a major problem. So for her, like, it wasn't the right fit. Those PTs didn't work with 26-year-old active women. They worked with 70 and 80-year-old active women and men. Probably they did a better job with those people than I ever could, because that's who they see every day. And so there is an amount of repetition and really getting to know the underlying fears and the underlying aspirations. And hey, typically when somebody who is active like this has this type of pain, is typically for these 4 reasons. And you can go into it and look at that versus somebody who doesn't see that every day. They wouldn't know those things. So there becomes, that depth of knowledge in your narrow kind of niche that you would know that nobody else would. And that's when you find that perfect PT patient fit.
Yeah. Yeah. Well said. I agree 100%. Well, it sounds like your target market, like your niche, the focus is your everyday athlete who probably tends to be a little bit younger. Who would you say this book is for, Dr. Jamie?
Yeah, I wouldn't say. Let me go back on that. So I wouldn't say our average athlete is necessarily younger. We're actually, about age 35 through 55 is our kind of our major people that we work with. So not old by any means, but they're not people in their 20s either. They're people who are struggling with real life, finances and family, and they have all of those complications. And so this book was really meant for somebody like that. And so whether they're just starting their journey and they're kind of looking into, hey, where can I start this? That's one option. But really, we found that most people who have bought the book have already tried 4 or 5 other things that haven't worked. So they're kind of, luckily, they're not giving up on themselves yet. And they're starting to really dive deep on, where can I find the information to help myself? Where can I find the person that I trust to help guide me into where I want to be? So, that motivated active adult who is not ready to say, I'm giving up on this yet. They don't want to give up their activities. They don't want to give up their lifestyle. They're too proud and too, let's just say too proud to hang it up just yet. They're not ready to hang up the cleats. I got to find a way. This is for that person who really wants to find another way to get back to their hopes, dreams, in life.
I know a bunch of those people here in my clinic. That's perfect for them. I have marathon runners that are in their 50s, and
Mhm.
They have been told by healthcare professionals, you're too old to be running this much.
Yeah.
And yeah, I tell them here in the clinic, heck no, you're in great shape. You just
Right.
got a
Like,
little ache that needs to be addressed. You can
why
keep
would
on.
you stop? Yeah. It's so frustrating. I hear it on a daily basis. I literally heard it 30 minutes ago before jumping on this. Um, so, we hear it every day too. And for some reason in medicine, we think that, activity is bad, or not in PT, but you know what I'm saying, in surgeries and things like that. They think that the amount of activity is rubbing down the bones and all that. And we know it's not, because we help people every day get back to these things. And, I think everybody is individual, and we have to start taking a more individual approach based off of the body, the biomechanics, what they want to do, what what sport they want to do next, what their lifestyle is, what their training is, weights, but we also have to do a better job of getting people active throughout their lifespan. I think the number one reason people are not active as they get older isn't that they don't want to be, it's because it hurts, right?
Yep.
You get stiff, then you get old. You don't get old and stiff.
Yep.
So, if we can help prevent people from getting stiff, we can keep them active throughout life, improve not only their mindset, but their happiness, their life quality, and then all the actual body things, blood pressure, heart disease, cardiovascular disease, all the myriad of things that exercise helps with. So I think we need to do a better job of that, just as all medical professions.
Yep. Awesome. Well, thank you so much for your time and for sharing your knowledge. I appreciate it, Dr. Jamie.
Yeah, my pleasure.
You gave me your clinic's website. Let me put it up here. So it's kineticchaindenver.com. So just in case you want to reach out to Dr. Jamie, if you're an everyday athlete and you want to go see him in Denver, there's his website. Go reach out to him and get his knowledge. And if you haven't already, go get the book, Adding Insight to Injury. Super great read. Fantastic gift for your everyday athlete that you might know. That person that's in their 30s, 40s, 50s, and beyond, and is still ripping up the turf, the field, the slopes. Go get that book. Anything else you want to tell the viewers before we let you go, Dr. Jamie?
Yeah, I think since we talked about the shoulder, we sent you a download for shoulder pain. So if any of you have shoulder pain and maybe kind of want to know just a little bit more about it, we have a download called the 13 Ways to Tell If Your Shoulder Pain is Normal and if you should see someone about it. So that can help just kind of guide you on the next steps you need to take, and we can go from there.
So here's the website for that. This is kind of a long URL, but I'm going to put this in the description below. So go check it out if you want to get that free download from Dr. Jamie. Thanks so much, Dr. Jamie. I appreciate you so much.
Well, thanks for having me on, and everybody, thanks for watching, and stay active.
We'll see you in the next video. Bye-bye.